Every hour in Nigeria, 9 women lose their lives while giving birth. 9 mothers. Every single hour. 75,000 every year. Gone too soon. And for over 2 decades, Nigeria has remained in the world's top 10 for maternal deaths. By 2021, she climbed to number 1, a crown no nation should ever wear. But why? Why does a country blessed with trained health workers still bleed at this rate? Why do others move forward while we stay stuck in the same grave statistics? Sierra Leone cut maternal deaths by 78%. South Sudan 58%. Ethiopia more than half. And Nigeria barely 13% in over 20 years. So, why does a woman's chance of survival depend on her postcode? Why does childbirth, a moment of joy, still end in mourning? Maybe the problem isn't what we lack. Maybe it's who we've refused to empower, the community health practitioners. Behind every statistic, there's a story. A woman who should have lived. A child who should have been held. A health worker who tried but was never given enough to succeed. Across Nigeria, thousands of community health practitioners fight quietly in the shadows. They walk for miles through rain and dust, carrying vaccines in melting ice boxes. They deliver babies with lanterns when light fails. They dress wounds with whatever little they have. They are the first faces of hope in forgotten villages, and too often the last faces the dying ever see. But why are they invisible in the system they sustain? Why are they underpaid, under-equipped, and underused? Why do we expect miracles from those denied the tools to perform them? Most pregnant women in rural Nigeria never make it to a hospital. Their only chance lies with these practitioners, the ones who know their names, their families, their stories. Yet, without support, even heroes can only do so much. So again, why are we watching them struggle alone? Why do we keep losing mothers not because help didn't exist, but because help was never empowered to reach them? Let's look beyond our borders. Ethiopia empowered its community health practitioners to reach every household. Bangladesh trained and trusted theirs to bring care to rural villages. Brazil turned its family health strategy into a national movement, making health workers the bridge between people and policy. 3 nations, 3 stories, 1 truth. When you empower the grassroots, the nation grows stronger. So why not Nigeria? Why do we have the talent, the training, the reach, but not the recognition? What are we waiting for? The world has been shouting this truth for years. The World Health Organization warns that over 70% of health challenges in developing countries can be solved at the primary healthcare level, if community-based workers are empowered to act. Yet, in Nigeria, that frontline remains neglected. Thousands of trained professionals sit idle, buried under red tape, restricted from doing the very work they were trained to do. While Ethiopia built an army of community health agents, Nigeria kept hers on the margins. Why? Why do we invest billions in curative hospitals, but starve the roots of preventive care? Why do we call it lack of manpower, when trained hands are waiting, willing, ready? The National Primary Health Care Development Agency admits over 40% of Nigeria's primary health centers are either understaffed or not functional. So if the workers exist, if the training is done, if the need is desperate, then why are the hands that could save lives still tied? Change has never been impossible, only ignored. Nigeria already holds the key. The community health practitioners she trained but never trusted. They are in every community, every settlement, every forgotten corner of the land. They are the heartbeat of our nation's health system, but the heart has been silenced for too long. Why not listen now? Why not invest where life begins, not where it ends? Why not build a system that values prevention over reaction? Ethiopia proved it. Bangladesh proved it. Brazil proved it. So why can't Nigeria? Every mother who survives childbirth, every child who gets vaccinated, every family saved by a health worker, that's not just progress. That's survival. That's dignity. That's the beginning of a healthier nation. The world is watching. History is waiting. And the question still echoes. Why should 9 Nigerian women lose their lives to childbirth every hour, when the solution has been here all along? Empowering community health practitioners equals empower life.